Good afternoon, and thank you for joining us. 6 months ago, we began working on a program that we now call Test to Protect. And we started working on it so that we could provide asymptomatic pooling testing for teachers and students in preparation for in-person learning this fall. To give you a quick refresher, the pooling method, which required us to get FDA approval, and I have to note that Memphis was one of the first cities to get that approval, combines multiple patient samples and runs the test of all the samples together. If the results are negative, all samples are cleared. If they come back positive, each pooled sample is then run individually to determine who may be positive. The program is funded through the Federal CARES Act dollars, and we've partnered with labs, Poplar Healthcare, AEL, Compass Labs, UT Health Science Center, to perform our test results. The goal of this program has been to help those schools in the city of Memphis who want to open up safely this fall with in-person learning by regularly testing asymptomatic students and teachers. I do want to note that our partnership for the schools has been limited to Poplar Healthcare. Those other labs are going to be part of this program that we're announcing today. By doing this, we are able to quickly determine where a potential hotspot may be and stop it before it spreads. We are now ready to take this program to the next level by opening it up to businesses and restaurants who want to take the extra precautions of getting their employees tested on a regular basis. So far, we already have 24 restaurants signed up to participate. The Majestic Grill, Cocoza Italian Restaurant, both owned by Denny and Patrick Riley. Restaurant Iris, Second Line, and Finno's, all three owned by Kelly English. Tsunami, owned by Ben Smith. River Oaks, owned by Jose Gutierrez and Colleen DePete. The Rendezvous, owned by the Vergas family. Sweetgrass, Sunrise, 117 Prime, and Central Barbecue, all owned by Ryan Trim and Craig Blondis. McEwen's on Monroe, owned by Bert Smythe and John Littlefield. Felicia Suzanne's Restaurant, owned by Felicia Willette. And then 4 restaurants owned by Michael Hudman and Andrew Tyser, Andrew Michaels, Catherine and Mary's, the Gray Canary, and Bishop. Acre, owned by Wally Joe. Bari, owned by Jason and Rebecca Sevier. Erling Jensen, the restaurant, owned by Erling Jensen. The Beauty Shop, Hazel's Lucky Dice Delicatessen. And Back Dough at My Yard, owned by Karen Carrier. For more information on this new program, this expanded program, Test to Protect, please go to our website, covid19.memphistn.gov. I'll now pass it over to Dr. Manoj Jain for more information on how the testing will work and how to get signed up for this program. Dr. Jain.
Thank you, Mayor, and good afternoon, everyone. Clearly, the numbers are going up, and that's a cause for concern. We're seeing the daily number of cases go up. We're seeing the transmission number being greater than 1. We're seeing the positivity rate also higher than 15%. So what can we do? We know that masking works. It reduces the risk of transmission by fivefold. We know distancing works. It reduces the risk of transmission by threefold. Also, testing works. So today, I want to talk about testing and the innovative approach that Memphis and Shelby County is taking towards this. It's called assurance testing, or we're calling it the Test to Protect program in Memphis. Assurance testing has 5 core components. First, that it's asymptomatic. It's done for individuals who are healthy. Second, that it's large scale. We're doing about 3,000 to 4,000 tests. We're talking about going to 30,000 tests per day. Third, it's low cost. Usually a test costs about $100. we're talking about reducing the cost to $5 to $30. Next, that it's regular testing, not just one time, but you're testing on a regular weekly or once every 2 weeks interval. And lastly, that it's convenient. People can do it with a do-it-yourself kit in their office or at their home. So that is what assurance testing is. We have piloted this program, as the mayor has said. Schools have been doing it, and we've been doing it very successfully. Also, we'll be seeing restaurants starting to do this. My businesses are doing it, including my office. For the past month, everyone in our staff has been tested at a regular basis every week. Churches have been taking great interest. Scott Morris had a long conversation with me, and we have multiple churches who are interested in this program. So, a few things that we must know about this program is that it's for individuals who are not having any symptoms. Also, if you have also not had any contact with someone who's been positive for COVID. So this program is for asymptomatic individuals who have not had contact and who have not had a positive COVID test over the past 3 months. We're really grateful and with the collaborative relationships with the laboratories in Memphis. Jim Sweeney from Poplar Healthcare, from AEL, David Smalley, and a number of other labs have collaborated with us to make this possible, using the strategy that you heard the mayor talk about called pooling. And what that has done is allowed us to increase our capacity and reduce the cost. This is a unique program, and Memphis is one of the cities amongst few others in the country who has this program. So I'm going to have Jim Sweeney talk more about the laboratory component of our Test to Protect program, which is for assurance testing.
Thank you, Dr. Jain, and good afternoon, everyone. As Dr. Jain pointed out, we began and embarked on this journey about 6 months ago, trying to get ahead of the supply chain constraints that we were having. As many of you know, there were many issues getting testing done in a timely manner. And instead of the labs competing against each other, we began working with each other. And as we forged forward and working out these techniques of pooling and trying to figure out more innovative ways to provide testing in a safe, assurant manner, we shared the knowledge with each other. And we're very proud of what we've accomplished. Through that effort, we've kept in touch with the FDA and regulatory authorities in Washington, making sure they were aware of our progress. So you take my lab, for example, at Poplar. We could today do 4,000 individual tests. Back in April, we could have only done 2,000. But now with pooling, we have the capacity to do between 20 and 25,000 tests a day. And the same is true of AEL, Compass, and UT. As you look at this program, I want to assure you that not only is it safe, but the results will get to you very quickly. Most of the pooled testing is reported back within a 12-hour period of time. And it is the gold standard. It's PCR testing. We're not talking about the antigen or any of the rapid tests. It's the test that ultimately needs to be done in order to diagnose the virus. Thank you very much.
Good afternoon, everyone. Alisa, Haushalter, Director of the Shelby County Health Department. And obviously my mask is going to get hung on my ear, so I apologize for that. I am going to today give a few brief updates as I typically would, and then I want to speak a little bit more to assurance testing as one of the tools that we have in our toolkit, or we could reference it as a weapon in our arsenal against COVID. And then we'll open it up for questions. In addition to me, Dr. Randolph is here, so either of us can answer questions specifically from the health department. As Dr. Jain said, our numbers continue to go up, and as of today, we have 38,741 cases. Unfortunately, we have lost over 580 individuals to COVID, and we have had an increase of 265 cases in the past 24 hours. We do know over the past week we've averaged over 200 cases per day, and as we all know, our numbers were going up significantly. We've seen a little bit of stability, but I don't want that to be a false sense of security. We are still at a very challenging time. We do anticipate a very difficult fall, and so it's important that we do use every tool that we have or every weapon that we have in our arsenal. We know that masking works. We know that social distancing works. We know specifically here in Shelby County that individuals continue to go about their activities of daily living while they're symptomatic. So staying at home when ill, really with very minor symptoms, is a critical piece. But the assurance testing that was just referenced, as well as the project or program of Test to Protect, is critical in our ability to move forward. I really want to commend Mayor Strickland and Dr. Jain, as well as all of the labs, for focusing locally and building our capacity to be able to do assurance testing locally. Again, this is not being done in many places in the United States, and it's a testament to the commitment within Memphis and Shelby County to serve the constituents here. It's an opportunity for individuals who are asymptomatic and may actually have COVID to get tested. But the critical piece of that is it allows us then to isolate and quarantine those individuals who may pose a risk to the rest of the public. As of today, we have 2,709 people who have active COVID in our community. Those individuals are under isolation, and we have another 8,100 people who are under quarantine. So that means we have well over 10,000 people today who are under a public health order. So the assurance testing allows any business, school, or organization that's participating to know quickly who needs to be excluded from the workplace to reduce ongoing transmission. So we're very proud of Memphis for their leadership here and look forward to working with others to implement assurance testing locally. And with that, I'll open it up for questions.
Brad Broders, Local 24.
Good afternoon, Dr. Haushalter. I wanted to get your thoughts on a new White House coronavirus task force report from last week, which recommended right now urging anyone in Tennessee to stop gatherings beyond their immediate households and also limiting restaurant capacity to less than 50% for now. I'd like to get your thoughts on whether you agree with that recommendations.
So it's a great question, and others may not be aware. There is a White House task force report that comes to the state of Tennessee weekly, and then that's distributed to all of us in public health leadership. And there were two key things in this week's report. The one was to reduce gatherings and limit your social interaction to not include anyone outside of your current household. Personally, that's not much different than what we've been saying for some weeks here, is that we have to reduce our interactions with others and limit it as much as possible to our own households. And if we are going to interact with others, to wear a mask, even though we may not be in a public setting. So an example may be, and I've used this before, if I'm visiting my mother in Nashville, I wear a mask while I'm in her home to protect her. So I do agree with that. The other was specifically to reduce capacity of restaurants to 50%. The purpose of reducing to 50% is actually to facilitate social distancing and masking. So I won't say that we're going to change what we have in our health directive to limit capacity to 50%. We're going to reinforce the need for social distancing and masking while in restaurants. That'll achieve the same outcome or purpose. But I also want to add that it's really important that people consider whether or not they want to go to a restaurant. Any indoor activity where one must remove their mask is a risky activity, and right now it's more at risk. I do think with assurance testing, that does at least know that people who are in that workplace that test positive have been excluded, but it doesn't necessarily mean that the other customers have tested negative. So if you do choose to go to a restaurant, wear your mask at all times with the exception of when you're eating or drinking, and then choose to go at times where there's less people in the facility. So that was a long answer to a short question, but hopefully I covered it in detail.
Thorough as always, Dr. Haushalter. And as a follow-up, the hospitals are now we're now ticking back above 300. What's just your overall thoughts on the hospital trends we're seeing? And I know I've asked this before, but do you anticipate the return of any restrictions potential?
So we're all concerned about hospital capacity, but that's for several reasons. One, there is increased admissions. We know they're COVID related, but as we've said before, a good portion of those cases are representative of surrounding counties. So we can do everything possible in Shelby County, but if surrounding counties are not doing likewise, it's going to continue to burden our healthcare systems. Many rural communities don't have hospitals. If they do have a hospital, they may have limited or no intensive care beds, and they may not have subspecialty services. So they're going to come to the large metro. So we're going to continue to be impacted by those rural counties. And so taking a more statewide approach for things like masking is going to continue to be critical. We do have to look at the data every day and consider whether or not we have to put additional restrictions in place. We have talked about those, but at the current time, the most important thing that we can do is based on individual actions and actions within households and workplaces. If we closed anything here in Shelby County, people can go back and forth across the county borders and state lines. And so if there's transmission in those communities, it's going to impact us greatly. So it's quite different now than it was in March and April, and quite different than it was in June and July. That's why the pooled testing or assurance testing is critical, because it does create another opportunity for us to stay open, for children to continue to be able to go to school, but for us to contain the virus as soon as we know someone's infected.
Dominique Dillon, Fox 13.
And another question regarding rural areas. For many months during the pandemic,
Dominique, I think we lost you. We'll come back. Jane Roberts, Daily Memphian.
Could you give us some more information about the testing for restaurants, about including what the expense might be and sort of the timelines for getting started?
Yeah, I'm actually going to turn that over to Dr. Jain so he can speak to it. Or Mr. Sweeney.
Thank you. The testing for the restaurants would work as follows. There's a technique of pooling that they can do multiple samples into a tube, and for $100 we can test up to 20 people in that tube. That's the program we presented to the restaurants, so they have that choice along with individual pool testing. They have the discretion to pick which one, so they could, the range for them would be anywhere from $5 to $15 per employee.
So I'll add to that. There's a certificate which the restaurants can then display in their window, and other businesses can display as well. So this will let visitors know, that patrons know that that restaurant is following a test to protect protocol. And so we're really encouraging other businesses and restaurants, doctors' offices, and others to take on this program for testing on a regular basis.
And you have a follow-up?
Jane, did you have a follow-up question? Kelly Roberts, WMC.
Hey there, I have one quick question regarding that report from the White House as well. It looks like it named 64 of Tennessee's 95 counties in that would be considered the red zone, and Shelby County was not on it. Is there a point that you want to get across that, you know, even if Shelby County isn't on that, you know, how much the surrounding counties actually really do affect what we see happen in Shelby County?
That's a great comment. So we have some rural counties specifically that their cases are growing exponentially. Shelby County, while we've increased, we've not increasing at the exponential rate as those rural counties. However, we also have a larger population, so we've got to consider that, and our case per 100,000 rate is not as high as those other counties. So that's what puts us not in the red zone. But as you noted, and I noted earlier, those surrounding counties are going to come here for health care. people also come here for other things. They come here to shop, to work, and so on. And so when there's transmission in those surrounding communities, it's going to impact us greatly. It's going to impact our systems, but it's also going to impact our ability to contain the virus within our own community.
Kelly, did you have a follow-up?
No, thanks, guys.
Greg Akers, Memphis Business Journal.
Hi, I had a follow-up about the Test to Protect program. It was said it was $5 to $15 per employee. Is that per week? And have those restaurants who've signed up for it, have they signed up through a certain date, or is it just indefinite?
So I'll start, and then I'll turn it over to Mr. Sweeney. It would be by test.
The $5 to $15 varies upon the technique of pooling that they opt in for. And it would be recommended that they do it weekly. Dr. Jain can comment if the restaurant was to change that. But at this point, we're encouraging them to do weekly testing. And we're in the process of interacting with many of them and getting them set up along with some of the other labs.
So the pricing and frequency really depends on what the positivity rate is. And so each restaurant, each business, each setting has to look at what their positivity rate is and discuss it with some of the health experts. And then they can better decide with the laboratory which method is best for them for doing pooling. We've developed a guidance document on this. Dr. Haushalter, Dr. Randolph, Dr. McCullers, and I have a detailed guidance document, and you can see that at the website covid19.memphistn.gov.
Greg, did you have a follow-up?
Yeah, I was. You had said that, or Mayor Strickland said that CARES Act funds were involved in kind of setting up the pilot program. I'm wondering if they're in any way subsidizing this program.
No, the CARES Act money is being reserved for schools. So it's not involved in this program. But we built the apparatus both scientifically and operationally through this process. Now we're just offering it to the businesses at their cost.
Dominique Dillon, Fox 13.
All right. So for many months, this question is about rural counties. During the pandemic, it seemed like they were spared from COVID and growing cases. But now, as we see, their cases are skyrocketing. Why is that, and what would you say these counties should possibly do?
That's a great question. Some of it really has to do with population. So generally when you have an infectious disease, those more populated areas, particularly where people live closer together and there are large populations, or a metro area where people travel in and out, that's where the first cases generally occur, and that's where transmission begins. And so you have hot spots in those big metro areas first, and then there's movement out to more rural areas. Tennessee is unique in that our public health system is a dual system, and I think we've had some conversations before and questions around the authority of local government and authority of local health departments. One of the reasons we have authority is to be able to address epidemics locally very quickly, but it also means that we may not have the same strategy across the state at the same time. So while we had safer at home orders here, we had business closures and mandatory masking, that was not happening across the rest of the state. So as there was movement into those rural counties, transmission started to occur very, very quickly. Many of those communities still are not masking. Either they don't have a mandatory mask, either ordinance or order, or they've chosen not to enforce it. And so that's not uncommon to see that movement from a metro out to the rurals, but given that we have an inconsistency in our approach across the state, it creates these pockets of ongoing transmission in the rural areas.
Thank you.
You have a follow-up?
No, that is all. Thank you.
Thank you.
Michaela Watts, Commercial Appeal.
Yes, good afternoon. Thank you. I have a question about the assurance testing. what protocols is the city suggesting that employers follow taking part of this program when it comes to a positive result? So, for example, if a pool comes back positive, will all employees be instructed to stop work until individual tests can be taken? And if so, will cities supplement pay to these employers?
So I'll leave some of those answers to the mayor, but I will address some issues about the protocol. The protocol would be followed as any other protocol is when someone is positive, and the health department does an excellent job of working with the business or a workplace and able to make sure that people are safe. In terms of the city, Mayor, I'll let you answer.
Yeah. With respect to the businesses, we have no financial incentives to participate in this program. It's just, the reason this testing is so important is because if you don't do it, these folks who don't have symptoms are going to infect more people. And as a result, more people will be positive and more people will miss work. So this is a tool to use to pinpoint the people so fewer people miss work and fewer people have to go through that financial hardship. And it's just a tool, just like masking and washing your hands and social distancing, to allow these businesses to better protect their employees and their customers.
Add something real quick. While there may not be funds to directly compensate someone who's out of work, there are many, many resources available to assist people in Shelby County. If an individual is placed under isolation through a public health order, we work with them to identify what their needs are and then to connect them to resources. And then the website that was referenced earlier, the city's website for COVID, there's a listing of resources there, and then individuals can always call 211 as well. The one area beyond some of the others that we've already mentioned that Shelby County has excelled, and I know this from dealing with other public health professionals, we have done an outstanding job at trying to put supports in place to assure that individuals who are impacted by COVID can receive resources locally. So there are plenty of resources available.
Great, thank you. And I just have a quick follow-up. Dr. Haushalter, we've been talking about what seems like for months now about how behaviors from surrounding counties impact Shelby County. At this point, I just got to ask, what are these surrounding county officials, what excuse are they using to justify not asking their citizens to mask up when they know that their county's behavior is clearly impacting ours?
So I can't really speak to any individual comments or beliefs or ideals of elected officials. What I do know is our elected officials locally, all of our mayors have had conversations at the state level as well as reached out to their counterparts in rural counties, encouraging them to, at a minimum, move forward with mandatory masking. So we're doing everything that we can to influence others. I think we also serve as a role model here in Shelby County of how we can come together and, as I've said before, have conversation and sometimes robust debate, but come to a plan that's the best plan locally, and we can share that with others. So we're doing our part to influence.
Those are all of our questions today. Are there any closing messages from any panelists?
You want to have any closing comments, Mayor?
The only closing comment I have is something that Dr. Haushalter said many times before, that and government can't address these 2 points by ourselves. We need your help. Number one, if you're sick, stay home. There's a lot of transmission going on when people are sick and they're going to work or to social events or to ball games. We need you to stay home. Secondly, family gatherings. Only the people you live with are the ones you can feel free to hang out with without a mask. There's a lot of transmission going on through close friends and extended families who are not social distancing, they're not wearing masks, and because we've let our guard down. Those are two areas where we need people to take personal responsibility and step up to do their part. Thank you.
Thanks, everyone. We'll see you back here next week.